Hello, and welcome to Credentialing Basics. In this presentation, I will be providing an overview of the credentialing process and all of the pieces that are involved in good and effective credentialing. Whether you are new to credentialing or one of our more seasoned credentialers and taking this training to refresh or refine your credentialing knowledge, our objectives are to provide you with information and tips to assist you in applying your knowledge to the work you do so that you can apply the information and the strategies you learn to accomplish effective, efficient, and quality credentialing so that we can get the right providers in place to deliver the high-quality health care that our veterans deserve. Credentialing is one of the most critical activities performed in our healthcare facilities. It is a patient safety activity that supports getting the qualified professionals who deliver health care by confirming those qualifications and verifying competence to provide that care that we are expecting them to deliver. By systematically verifying the education, training, licensure, certification, and experience, we are supporting not only the delivery of high-quality care, but hopefully safe patient care. A full assessment of the applicant prior to their entrance on duty reduces the risk to patients for adverse outcomes, thereby reducing the liability of our organization. Credentialing is the foundation of patient safety. In credentialing, we divide our processes into two basic processes based on the Joint Commission standards. Those providers that practice independently are called licensed independent providers, or you may be familiar with the acronym LIPs. This category includes physicians and dentists and any other healthcare providers who are granted clinical privileges. APRNs, PAs, and clinical pharmacists who practice on a scope of practice are credentialed as LIPs, even though the facility where they work or their license requires them to be in a collaborative agreement. This is because they are required to be credentialed as LIPs by the Joint Commission, regardless of whether or not their license allows them to practice as LIPs. Other professionals, such as psychologists, optometrists, podiatrists, audiologists, speech pathologists, and social workers, are only credentialed as LIPs if both their license allow for independent practice and the medical staff at your facility grant them independent practice. You will find the medical staff's decision defined in the medical staff bylaws at your facility. All other healthcare providers that are required by qualification standards to be licensed, registered, or certified are required to be credentialed in accordance with VHA Directive 2012-030, Credentialing of Healthcare Professionals. These are the non-LIP providers, who you may also hear referred to as dependents. But that is not the best term. They will go through a dependent credentialing process in accordance with the directive. The list of occupations on Attachment B is not all-inclusive. Remember, I said a few minutes ago, this group includes the occupations that are required to have licensure, registration, or certification as applicable to the position or required education for the occupation that they are appointed in. All credentialing of either LIP or non-LIP providers is accomplished in VetPro. So let's talk about who needs to be credentialed. I've already mentioned VHA Directive 2012-030, Credentialing of Healthcare Professionals. This directive establishes the policy that has to be followed for credentialing these non-LIP providers, which I am going to call dependent credentialing. VHA Handbook 1119, Credentialing and Privileging, is the policy that defines the credentialing requirements that must be completed when using the medical staff process. This would be the process defined in the medical center medical staff bylaws. As I said before, this is the policy that would be used for credentialing LIPs, nurse practitioners, physician assistants, clinical pharmacists on a scope of practice, and other healthcare professionals that your facility has identified in the medical staff bylaws that have licensure that permits them to practice independently, and the facility will grant them clinical privileges to provide patient care services independently. Things work differently in different facilities. Each facility establishes their own process to meet all the pre-employment requirements. This presentation is going to be somewhat global and address the credentialing requirements outlined in VHA policy. It is important to remember that an applicant cannot complete VetPro until they have been enrolled in VetPro, which is usually done by the credentialing staff. If the provider has completed VetPro previously, their file may be inactive. If you try to enroll the provider and get an error message that the Social Security number already exists, it should tell you where. If it tells you VetPro headquarters, you would submit a help desk request to have the file transferred to your station. If it tells you the file is at another facility, you make a request for access through VetPro. It is extremely important that the applicant be given instructions for completing VetPro and the correct login information. If you haven't already been there, I suggest you go to the Office of Quality, Safety, and Value and look at the resources that are available to you. You may want to consider sending the Dependent Provider Quick Reference Guide posted on our website, which includes useful tips to help the applicant. Your instructions should also include how to access or log into VetPro. This is on the letter you print from VetPro, but maybe highlighting it can also help. It's helpful when the instructions include what information the provider will need to have on hand before they log on. This would include all license numbers, initial issue date, expiration date, names of educational institution dates, addresses, names and addresses of references, and former employers' addresses and dates. It's helpful to tell them that they must enter all information beginning with their first degree for the occupation, including completion date, and then go forward, being sure that there are no gaps greater than 30 days. Before the provider is able to submit, they have to account for all gaps greater than 30 days. Sometimes we see the providers juggle the date of completion or a job to make a gap disappear. When you verify this, it is going to recreate the gap, so you can't get the file to a verified status. So the provider must fill in that gap. Helping the applicant get organized prior to the application in VetPro may be a contributing factor to the success of the VetPro experience and their ability to easily and quickly complete and submit their application. Once they have successfully submitted their application in VetPro, The thank you screen that lets them know it was successfully submitted gives them the option to print the human resources application associated with their occupation. This will be populated with the data the provider entered into VetPro. The applicant will need to closely review the application and complete any required fields that were not populated. Then they print it off, sign it, date it, and submit the application according to your facility's process. Some facilities schedule appointments with the applicants for one-on-one assistance in completing VetPro. They may also complete their physical and fingerprinting requirements all on the same day. This process may be helpful not only to the applicant, but also the credentialing staff, since you could be rarely available to answer any questions and guide them through the process. This may also eliminate the need for multiple updates to VetPro, trying to capture all required information. Keep in mind that you may assist them in answering questions and identifying what information should go on the appropriate screens, but you can never enter information for them. This is a security breach and could result in disciplinary actions. The applicant will need to sign and date the release of information authorization and return it to you because it needs to be included with any written request for verification. We do want everyone to remember, when speaking with providers regarding their VetPro application, that you are credentialing the applicant, not VetProing them. VetPro is a tool that is designed to organize the credentialing process. It has checks and balances built in to assist providers in entering required elements for the occupation to which they are applying, so that all of the credentialing requirements required by policy are met. If you've developed the habit of saying someone needs to be VetPro'd, please consider using the correct term that someone needs to be credentialed. VetPro is an awesome software program, but Mr. Webster and Mr. Merriman have not adopted it and published it into their dictionaries quite yet. So, the credentialing process has begun with the submission of the provider's application. It is your job as the credentialer to get all appropriate verifications from the primary sources. If there are any questions or concerns during the process, you want to make sure you have a process in place to bring this to the attention of the service chief. In some facilities, you would take it to your supervisor, who would take it to the selecting official, while in other facilities, you would be able to take it directly to the selecting official. It is also important to have this process in place in case you hit a snag along the way and something is taking longer than expected. So identify what your process is. If you don't have a process, ask if one can be established. So let's get started looking at the basic elements you need to verify and how you will do that. Starting with education, if the institution provides verifications over the phone, you can document this conversation on a report of contact, or ROC in VetPro. You must document the name of the person you spoke with as the contact name and their telephone number. This is probably a good time to remind you that very rarely would you ever document your name as the point of contact, since you are the contacting someone else. Even if you contact the provider to clarify something, you would document the provider's name and telephone number, not yours. Your name will show up after you save the report of contact on the bottom as the person who completed it. Some institutions delegate their verifications to the National Student Clearinghouse as their agent for verifications. You do need to confirm with the institution that they have delegated their verifications to an organization such as this. The verifications are done online and have an extremely quick response time. You will print out the verification, initial and date it, and then scan it into VetPro. You will document in the comment section that you confirm with the institution that they have delegated this to the organization providing the verification. There is a fee for these online verifications. Just like any fee associated with the credentialing process, your facility is responsible for any fees. The other mechanism for obtaining verification is to do so in writing. On the education screen in VetPro, there is a letter that can be generated for this purpose. It will populate with the information entered by the applicant. So be sure the institution name and address are correct when you print it to avoid delays due to your letter being undeliverable. You will also need to enclose a signed release of information from the applicant and, if possible, a self-addressed stamped envelope. Upon receipt of verification, you must always compare the verified information to that which was entered by the provider. If there are discrepancies, you will need to address them either by contacting the provider and or the verifying entity to resolve and document your findings. In the end, you only want the correct verified data displayed in VetPro, supported by your verification documentation. Although not as frequent in the world of dependent credentialing, there may be applicants who have completed postgraduate training. It may be called an internship, a residency, a fellowship, or clinical fellowship. The provider entered it, so you must primary source verify it. You can use either a documented telephone call or a written verification using the letter in VetPro. Both methods were just described. Unfortunately, there really are no national websites where you can go and obtain the information. Sometimes there is confusion on the part of the applicants as to what goes on what screen. They might enter certifications on the license screen or vice versa. States issue licenses, although sometimes they will issue a state registration with or without a license. New York is a state that does this for physicians, so be sure to check. If the state issues a license like New York and then a registration, you have to check both of them. You also have to make sure that wherever you are verifying this, it also documents the history of disciplinary actions. New York is our example again, because they have a third website you have to go to if you're going to verify the disciplinary history. Certifications and registrations are usually issued by another entity, such as a national certifying body that may or may not be associated with the professional organization. We oftentimes find the certifying, although not an office of the professional organization, closely aligned in order to assure the professional organization's membership is aware of certification requirements. I'm going to use a non-clinical example, but the National Association of Medical Staff Services, NAMS, is the professional credentialing organization, and they have a certification board for the two certifications they offer that operates independently of the professional organization, but their offices are together in Washington, D.C. If you are having difficulty determining if an entry is truly licensure, ask the applicant if they have a copy so that you can see the issuing agency and assist the provider with correct data entries. The copy will identify who you need to contact for verification. When using an internet source for verification, the website disclaimer needs to be reviewed to determine the organization's attestation to the accuracy and timeliness of the information. If there is no disclaimer, then it should not be considered primary source verification. You can check the credentialing policy for guidance on the use of website verifications. Disclaimers change, websites change, so you should consider printing a copy of the disclaimer and scanning it with the verification, or keeping a dated copy of the disclaimer in a drop file. Other acceptable methods of verifying licensure include phone and written verification. If done by phone, you must complete the appropriate documentation on the report of contact. Remember, if you send for a written verification, you must include a release of information with your request. Information included in your documentation, whether on a report of contact or the written verification you receive, must include date of issue, expiration date, profession, nurse, physical therapist, speech pathologist need to be selected. Whether there are any past or current adverse actions. If there have been actions, the circumstances must be obtained and fully evaluated to determine if such actions restrict the individual's ability to practice in the profession for which they are applying. It is very important that you are aware of some very specific licensure requirements for applicants appointed on or after November 30th, 1999, who have been licensed, registered, or certified as applicable to the position in more than one state, and who had the license, registration, or certification revoked for professional misconduct, professional incompetence, or substandard care by any of those states. If you learn during your verification process that the applicant surrendered a license, you must pursue the information associated with that surrender. You have to determine if the surrender was after written notification of potential for revocation for professional misconduct, professional incompetence, or substandard care. These individuals are not eligible for appointment unless the revoked or surrendered license, registration, or certification is restored to a full and unrestricted status. The regulation covering this qualification requirement is Title 38, United States Code, Section 7402F. When these conditions are present, you should seek immediate consultation with the regional counsel as to whether the individual can be appointed. If there have been actions, the applicant should have disclosed these on the supplemental screen. Double check to make sure this information was documented in VetPro by the applicant. Again, you can verify certification and registration through a documented phone call using a report of contact, a letter, or through an internet website. You just need to make sure that you meet the requirements for primary source verification. Many times the certification websites that you go to for verification of a provider's certification won't have all the information required as primary source verification. You may need to follow up the website verification with a phone call or letter, or determine if there is a website for professional use that meets the requirements as primary source. The website requirements are the same as we discussed in a previous slide on licensure. You have to get the original issue date, the reissue date, and expiration date. You need to also know if there is any history of a disciplinary action. Yes, certifying and registration entities do take actions against their certificates and registrants. It is also very important to confirm expiration. For example, there are organizations where if you don't pay your certification fees, you are automatically no longer certified. This is also a good time to remind you that the disclaimer is important. Again, you can look at the policy and get guidance on what is acceptable. Many disclaimer statements on websites identify that the verification on their website is accepted by accrediting bodies such as the Joint Commission or NCQA. Just because they say it doesn't make it true. The Joint Commission does not recognize any website. Remember, even in the verification of education on a website like Student Clearinghouse, the Joint Commission says you need to confirm that the school or program has actually delegated it to them. Generally, you will find that the professional used websites will have a fee associated with verifying through them. There may be times when you start to search for the entity that issued the certificate or registration, you can't find the entity. First, you want to check the qualification standards to determine if the certification or registration is to be from a specific entity. Next, you can ask the applicant to confirm the name for you. Do not be shy about engaging the applicant to assist you in identifying who to talk to or where you can verify it. The purpose of obtaining a reference is to help provide additional information regarding the applicant's qualifications for the position for which they are applying. That is why we say that the reference needs to be knowledgeable of the applicant's qualifications for the position. They have lots of friends that they would like to use as references, but you are seeking references from people who are knowledgeable of their work as a professional. References should not be the service chief who will be completing the service chief approval on the provider that is being considered for the appointment. The service chief approval is the service chief's recommendation and the time when the service chief can comment on any known qualifications or experience. References may also provide information on performance or conduct issues and the individual's suitability. You need the information provided by a reference to be substantive. That means that the person can speak from meaningful experience or facts, that the reference is not just verifying that they know the individual for a certain time period. If questions or references are left unanswered, this could be a red flag and should be followed up with a telephone call to the reference to clarify their intent and leaving the answer blank. Speak with the selecting official to determine who should make the follow-up call. If made by the selecting official should provide you documentation of the call which needs to be signed and dated and scanned into VetPro with the original response. If you make the call at the direction of the selecting official, you too must document the call, being sure to sign and date your documentation of the call and what the reference said when you spoke with them. You can document this conversation in VetPro on a report of contact, or you can do it on a separate sheet of paper, which you will sign and date and scan the information into VetPro with the reference. The same process should be followed if the references provide any negative comments. If you remember, the personal history screen requires the most. Not all, but most of the occupations to enter what they have been doing since graduation. Why do we do that? Well, a review of it might give you and the selected official some insight into the person. Do they change jobs frequently? Are there periods of unemployment? You don't need to verify all of this information, but you do want to at least review it. Another reason to review it is to look at the states where they have worked If it was not a federal facility, were they licensed there? If so, that is a red flag, and you need to open the file for update and ask them to add the licenses. When verifying personal history, you are most interested in their previous employment and work history. It can be quite frustrating at times when you ask and you only get the dates of employment verified, and you do not get any substantive information regarding the individual's performance. While this is not most favorable, it does help confirm the lack of gaps in work history and confirms the applicant's entries. Remember, the reason for doing the credentialing is to gather information to support the applicant's ability to perform the position to which they are being hired. You may have a local policy that asks you to verify the entire work history, but that would be a local policy. VA policy only requires that if their last place of employment was not VA, that you must verify it. If they have worked in VA, you do need to contact the last 2 VA assignments or all VA experiences in the last 5 years, whichever is longer. What do I mean? If you have a nurse who applied to your facility and she has worked at 3 VAs in the last 5 years, you need to contact the 3 VAs and confirm employment and hopefully gain some substantive information on their performance and competency. If you have another nursing applicant who worked at a VA and left 8 years ago, you do need to try to see what information you can gain from contacting that VA. I also need to remind you that we are all family here, and if you are contacted by another VA for information, please assist them and provide them with appropriate information or refer them to someone who can. If we can't talk to one another, who can we talk to? Please do not refer them to a third party like Work Number. What do you do if the applicant tells you that you can't contact their current employer or a previous employer? Well, the first thing you should do is contact the recruiter or staffing specialist working the recruitment. The most current employer, although unusual, is understandable if they don't want the employer knowing they are job hunting. Any other employer other than the most recent employer is a red flag. But VA can't commit to not contacting current or previous employers, but the recruiter or staffing specialist may commit to not contacting them until the tentative offer is made. This is one of the requirements that presents some difficulties, but it is also critical to obtain what information you can. This is where we hope to learn something about their suitability to join our healthcare team. Remember, anytime you are having trouble receiving a response, you can always get the applicant involved to contact the employer and ask that they provide the requested verification. All of this is done to promote the safety and delivery of high-quality health care to our nation's veterans. The purpose of credentialing is not just to develop a file with required documentation. The purpose is to validate the individual's qualifications for the position and use the information collected to ensure we are hiring high-quality healthcare providers. It is your responsibility to collect this information accurately and in a timely manner. It's also your responsibility, as you are collecting this information, to bring any that presents potential adverse impact on the hiring of the individual immediately to the appropriate official at your facility for them to evaluate the information further. As you gain more and more experience, you will develop a sense that will help you identify potential risks that are not quite as blatant as an unfavorable reference or verification that required education was not completed. Do not underestimate the value of these instincts in setting you apart as a truly valued member of the healthcare team. More often than you might expect, acting on noted discrepancies has saved the agency and our patients from a provider who may have not had either's best interest in mind. Another valuable tool is maintaining your list of contacts. These might be people at certain organizations who have been very helpful to you. Having their names and numbers handy in the event you are in a crunch at some later date can really help you over a hump in obtaining required documentation. You can use your Outlook contacts to maintain this information where it will be handy for future use. Networking allows for problem solving or just brainstorming. Knowing you have a strong network of individuals in your profession and who can talk your talk may be the key to overcoming obstacles and developing new and improved ways of doing things. Ever heard two heads are better than one? Consider building relationships with other credentialing coordinators within your business. There are many details to learning all the ins and outs of credentialing. You can't be expected to know all of these from the very beginning. Find out who you are to contact when you have questions. Then determine the best method of addressing your questions when they arise. For example, would your contact prefer you ask them immediately, or maybe set aside a few minutes each day to review what you need to know? Maybe they prefer email, as long as no personal identifiable information is included. Failure to ask questions does not help you or your facility. Time wasted in doing things incorrectly can adversely affect getting the right provider to the right patient at the right time. Remember that you have a vision liaison in the Medical Staff Affairs team, Office of Quality, Safety, and Value, who is available to assist you as well. If you are not certain who your vision liaison is, ask your lead credential coordinator. It's also especially important to ask for help when you are overwhelmed or you anticipate difficulty in meeting a stated deadline. Everyone has experienced times when unforeseen tasks or events impact their ability to complete some other task at hand. One of the biggest challenges of your position is dealing with all the competing priorities. Learn to recognize when you might be taking on too much or encountering more obstacles than you had envisioned, or something is not going as fast as you had hoped. It is far better to identify these potential stumbling blocks as early as possible rather than letting things pile up and miss critical deadlines, trying to juggle too many balls in the air. Do not look at asking for help as a sign of weakness. It truly can be a sign of showing your dedication to the big picture and wanting to prevent any adverse impact. Know and understand the requirements for education, licensure, and certification for the different occupations. The vision calls give you the opportunity to ask questions and to share in the dialogue of what has worked for others and the advice from the Medical Staff Affairs, Credentialing, and Privileging staff on how to manage different situations. Ask the lead coordinator to give you coordinator access to the developmental test facility 999. Working in a test facility can give you the opportunity to practice as a coordinator, a service chief, or a provider in VetPro to improve your technical skills in VetPro, as well as give you first-hand knowledge of what service chief and providers experiences when working in VetPro. This can go a long way in your ability to provide excellent customer service to service chiefs, providers recredentialing, and first-time applicants. I don't know how many of you have been on our website. These are some helpful resources that you can find on our website. We have Credentialing VetPro Tips of the Week, Credentialing Policies, Credentialing Links to Relative Sites, Education and Training Verification Resources, Records of Control System, and much more. This concludes our presentation on Credentialing Basics. If you have any questions, please email us at bhacred-priv@va.gov. We will be glad to respond. Thank you.